Today's video was not sponsored by Waterpick.
Hi everyone, this is Noe. Thank you for taking the time to take another look at one of these wonderful and helpful videos. Now, if you find this video helpful, share it. Today we're going to talk about the Waterpick and the accessories these are the controls for the unit. This switch allows you to turn the unit on and off. This right here is a little dial. You're going to notice it goes up in increments of 2. You're going to see 2, 4, 6, 8, and 10 actually represent the PSI, and it actually goes up in increments of 10. So when you see 6 is actually 60, when you see 8 is actually 80, when you see 10 is actually 100. Now, based on clinical studies, it has been proven that a PSI of 60 and above does a great job as far as removing the plaque biofilm. So when you start using your Waterpick, try 6, which is actually 60. If it feels comfortable for you, you start off and you stay there and you move up as you feel comfortable. Now, if for some reason you start off using the Waterpick and you say, oh, it stings, it hurts, it feels uncomfortable, you just dial it down. You go down to maybe 40 and see if that feels comfortable to you and work your way up until you can get to a higher pressure setting. Remember, the Waterpick is great because it uses pressure and pulsation to remove that bacteria and to get you the best end result. Okay, these are examples of some of the attachments that you'll get with your Waterpick base unit. So if you look at this attachment, this is a classic jet tip attachment. This is the one that you're going to use on an average basis. So the regular person using the water flosser is going to use this basic jet tip attachment. Now, this one is for ortho, those that are in braces. This is great because this is designed to get and clean around those brackets. So this is great. Now, this right here is called the plaque seeker. This is great for anybody that has cosmetic work, if you notice. So if you have veneers, it's great. If you have implants, it's great. If you have bridge work, this is great. So this is a great attachment for you. So another attachment is called the pocket attachment. This right here is used for those that have furcation. They may have periodontal involvement where we need to prescribe some medication to be placed underneath the gum. This is what you're going to use. This tip right here is actually going to be the only tip you're going to insert below the gum. This next attachment that you'll find, this one is a brush. You can see this is just for regular use. If you want to use the water with your regular toothbrush, this is great. We also have an additional jet tip that comes with your unit. This is great for those that have more than one user. So that way, if husband, wife, boyfriend, girlfriend, kids, whatever, if you have more than one person using the Waterpick, you can notice that it's color coded. So this band is white, this band is blue. So therefore, this one knows the Waterpick, this one knows this is their Waterpick. So this is effective for multiple uses. So if you're using any of these attachments, feel free to use the Waterpick correctly. Now, if you find this video helpful, please share it with someone. We're going to go over exactly what we need to do to use our Waterpick. The first thing you're going to do is have your Waterpick plugged up. Once it's plugged up, you're going to make sure you're going to add warm water to your reservoir. So you're not going to do cold, you're not going to do hot, you're going to do warm water. Once you insert this, you're going to look, make sure your unit is on, and then you're going to make sure you look down here to see what number you have it on, as far as do you have it on 4, 6, 8, or 10. Make sure it's a number that's comfortable for you. Now, once you start using your unit, look at this button. This one is the one that controls it to be on and off. Start off with it in the off mode. If you notice, this also swivels back and forth so you can get a comfortable angle for you when you're using your Waterpick. You're going to start from that back tooth. Once you put it, engage it right here at this back tooth, you're going to release and you're going to go around. Every time you get between your tooth, you're going to let it pulsate there for a few seconds. I say try for 4. So you're going to slowly go around. 1, 2, 3, 4. 1, 2, 3, 4. You're going to take this technique and you're going to take it all the way around to the other side. Once you're finished, you're going to open your mouth and then you're going to swivel this to an angle that's good for you. I noticed that a lot of patients, they miss the inner part of their back teeth, and the reason why is because when they're using the water pick, they just start off with the pressure on. So I say press that button on, let that pressure, stop that pressure, and make sure that when you start, you feel that back angle of that tooth. Once you feel it, then you release the button so you can make sure you're getting around the right angle of the tooth. And then you start and you go ahead making sure you let it pulsate there for 4 seconds, and you take it all the way around. You also take this technique all the way down to the bottom. So the same thing around, let it pulsate for 4 seconds, let it pulsate for 4 seconds. You take it all the way around. You do the same thing once you get on the inside. You press that stop button to stop the water, and you go around this angle. You feel it, then you release and let the water starts flowing. You keep going around and around until you finish, letting that pulsate for 4 seconds in between. Another helpful hint is when you're using your water pick to prevent any type of mess, make sure that your water pick unit, you're using it face down into the sink. So your head should never be facing the mirror. It should never be facing your friend. It should always be face down into the sink. So that way the water goes directly there and you have no splash. If you find this video helpful, please share it, and also like and subscribe.